But what do you do if you face typical risk or worse, symptoms, and yet you're not able to get the kind of diagnostic care or treatment you need? Sadly, this is a reality for many people in America, especially in communities of color, and something so many doctors, as well as patients, struggle with daily across the country.
I remember the nurse telling me, he's about to tamper with your heart. You're going to feel a little bit of discomfort. And then I died and went into sudden death. And it was seamless. I was here and then I was there in heaven. Then I was back here.
Tara Robinson never expected she would have a heart attack, but beginning in October of 2013, at the age of 40, Tara says her left arm started to occasionally go numb and had pain in her neck.
We were thinking maybe I slept on that side too much. So I started sleeping on my right side. I immediately started to self-diagnose. I know it sounds crazy or silly. When I described my symptoms to my doctor, I remember her saying, let me check your records because you don't have a history of blood pressure or cholesterol issues. And she said, well, maybe it's just stress. And so from that moment, I said, maybe it is just stress.
A few months later, Tara woke up in the middle of the night in extreme pain.
I sat straight up in the bed and I told my husband, hey, something's wrong. I'm trying to make my way to the bathroom because my left arm is numb, my neck is bothering, my upper back is in pain, I'm feeling like I need to vomit, I'm hot. So everything felt like something was misfiring.
She was taken to the hospital where doctors ruled out a heart attack.
I remember the doctor coming in and saying, well, the EKG is fine, your blood work is fine, and you're too young to be having a heart attack. I think looking back, race played a factor, the fact that I'm a woman played a factor, and not knowing what I was experiencing. Those three things played a factor because I didn't know how to advocate for myself if I don't even know what I'm experiencing.
But on her third trip to the hospital, doctors finally found out what was wrong.
I had 99% blockage in my main artery known as the Widowmaker. Imagine going back to the same hospital that sent you home. It's very hard for me to say that because the color of my skin or because of the fact that I'm a woman, that you would turn me away and let me go home to die. Looking back on it, I was sent home to die twice.
Studies have shown that Black patients presenting to the emergency room complaining of pain are less likely to receive adequate pain control or pain control for that matter at all.
Dr. Michelle Albert is a cardiologist with the University of California, San Francisco. She says the country's painful past plays a major role.
African Americans have had mistrust of the healthcare system for good reason. They have experienced experimentation in the past related to research and other types of discrimination. And so the community is not trustful of standard medical structures and systems.
According to the American Heart Association, while heart disease is the #1 killer of all Americans, African Americans experience a nearly 30% higher death rate from cardiovascular disease. The American Medical Association recently identified a new set of guidelines for healthcare providers to better identify and combat health inequities like these.
We all have biases, and those biases can enter into the care that we deliver to our patients. Many institutions are actually mandating implicit bias training for its staff at this point.
After surviving her series of heart attacks, Tara is now wasting no time, and she's committed to helping others find their voice.
If you don't feel comfortable talking to your doctor, find a doctor you feel comfortable talking to. And really, minorities feel more comfortable talking to minorities. So if that's the case, do that. And then that means our white friends have some work to do as far as building relationships with the minority community. And I think it's up to those doctors to bridge those gaps.
And I'm so pleased to report that Tara continues to do well, and we thank her so much for sharing her personal story. If you think you may be at risk and your concerns are not being taken seriously, don't hesitate to seek a second opinion, if possible, from a different hospital or medical center. In addition, always ask for full copies of your records and make sure you understand the diagnosis and the steps for follow-up. And lastly, it never hurts to bring a companion with you to lend an additional pair of ears and eyes and help make sure all of your questions are answered and your concerns are addressed.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.